afternoon to everybody and welcome to an exciting meeting on diabetes in Vienna. Diabetes is a challenge. Back in 1985 there were 30 million people with diabetes in the world. 2000, 170 million people. The projection for 2030 in year 2000 was 370 million. We have already achieved that. Now the new projection is 554 million for 2030. It's an epidemic that is very difficult to halt. So to be able to do some good for our diabetic patients, it's a real challenge. And that is of course what we try to do in the program. Diabetes is not only just growing like an epidemic, it's also a costly disease that Professor Vaikassa was alluding to. I come from a small country in the northern part of Europe, Finland. In the year 2000 we had 200,000 patients with diabetes, which is nothing. The costs were 12% of the healthcare costs, 5.2 billion Finmarks. Forget the Finmark. What does it mean? The same year we had a Finnish company, it was still a Finnish company in 2000 called Nokia. It's not anymore. They made a huge profit. They were the 8th largest company in the world, 5 billion Finmarks. It just gives you an idea. When the world's 8th largest company makes a huge profit, it's less than the cost of one diagnosis diabetes in a small country. So think about that and it puts diabetes into perspective. So you understand it's a real challenge to put together a program that addressing this epidemic. However, the challenge, we have to get up to the challenge because EASD represents the largest association for study of diabetes in the world. This is the largest diabetes meeting. And of course, we want to be unique and we want to present new data, not only just repeat old data. There's a saying, I sometimes say that the English word research, I never understood the word. Research, you should do search. And that is actually what we try to do here. So we try to find the new bits and pieces where we can help our clinicians and of course also the scientists. So a few highlights what we have tried to do, but before I go through them I would like to say also another few words on the uniqueness of EASD. And that is the abstracts that are presented. We received more than 2,200 abstracts. And those are peer-reviewed. So, and we accept only about 55%. And I can tell you we are criticized for that because many other associations accept all the abstracts. But we are really trying to find the best science. And there was another wonderful paper in our journal, Diabetologia, written by our director and vice director of the EASD, showing that the meeting back in 2004, those abstracts that scored the highest and were presented, 85–87% of them actually made it into high impact journals, while about 13–14% of those that did not make it were ever published. So I think we try to be unique in this sense and try to present the best science. Our president said that this is the 50th anniversary, and of course we highlight that with a meeting tomorrow morning with wonderful speakers in the presidential addresses that they are not rising stars anymore. On Friday we have rising stars and they are stars. And I invite you to come and listen to them, and we will see what has happened during these 50 years, and I can tell you a lot has happened. We also have collaborations with the European Society of Cardiology, also the American Diabetes Association, and also the JDRF. So we have symposia with the ADA. We cover incretin-based therapies, which is something which is a very hot topic of today. With the JDRF, we are focusing on the innate immunity of type 1 diabetes, which is still a large problem coming from Finland with the highest incidence of type 1 diabetes, of course. I'm very pleased to be able to present that kind of symposium too. And then we have the one with the European Society of Cardiology, which is it's called Hypertension and Vascular Aging in the Elderly. And as a matter of fact, if you think about the epidemic of diabetes, every second type 2 diabetic in the future will be above the age of 65. Think about that. That basically means that we have to focus on the elderly, and that is also covered in this program. So collaboration with other societies. What we also have in this meeting is that we cover the new glucose-lowering medications, and especially the sodium glucose transporter 2 class, and that will also be on Wednesday. We also have a very interesting debate on Friday. One of the most commonly used glucose-lowering medications, metformin. Is there enough evidence for its use and so on? And that will be addressed by 2 absolutely excellent speakers on Friday. What we also have is, if you look at the program, this year we cover maybe something a little unexpectedly, the crosstalk between the brain and the pancreas. So the insulin-producing pancreas, and this is also I'm very happy about that. We also cover the complications. We have diabetic nephropathy, diabetic kidney disease, diabetic retinopathy, and also on Friday our president will run the show on the diabetic foot. He's one of the real global experts on the diabetic foot. And on Friday we are going to have something we call hot topics in diabetes. What is hot topics? What we cover there is new data. I haven't seen the data, but I heard they are extraordinary from the advanced study. This is not a year where large hard outcome studies are presented. Next year, hopefully, there will be, but this year not. So we look forward to the data from the advanced study on Friday, and also they will cover something about the new insulin preparation. So you can see we have quite a broad. So the treatments, the treatments of the new medications, and also I think what we should not forget is that we have a symposium on Thursday, risks and benefits of new diabetes treatments. So basically we cover the new treatments. What about the risks of them? We cover the old ones. Do we have enough evidence? We cover the complications. We do collaborations with some other associations, and also after this there is another press conference. I'm not going to talk a lot about that because we're on devices, so we have a symposium on the devices, which is also a very, very important topic at the moment. So the uniqueness of the way we present our abstracts, the posters and orals, and I can tell you that every single presentation will be oral presented, irrespective of being a poster or an oral presentation, because we have these discussions around the posters. That is also unique. And again, we look forward to a very interesting program, and I started to say that we have to have novelty, and we have really, together with my team of 16 scientists, diabetologists, endocrinologists from not only from Europe but also from ADA, put together this program and really try to find the new things, not only present research but data from research. So I'm happy to take questions.